Hi everyone. So if you know me well enough, you know that my favorite color is purple. So there's got to be a good reason I'm repping this much pink. And that is to help raise awareness and funds to end breast cancer through the Susan G. Komen More Than Pink fundraiser and walk. Now the walk in the DMV area is going to be on September 10th. And for those who don't know, that's DC, Maryland, Virginia. Our walk is September 10th, and we are raising funds in this area in order to support breast cancer research in the DMV as well as breast cancer patients. Now, you may have heard the stat that 1 in 8 women will be diagnosed with breast cancer in her lifetime. And given that significant number, chances are that that is not just an impersonal number to you, it may be personal in some way. Maybe you've even been diagnosed. I became one of those stats when I was diagnosed with stage 0 breast cancer in January. Now, thankfully, I'm fine, and all that was needed in my case to remove the cancer and treat it was surgery. I had a mastectomy in my cancerous breast. I did have to have the mastectomy because my tumor, although it was slow growing and not aggressive, it had been growing for a while. So that was the best decision for me. I'm grateful that that is all the treatment that I needed. I did also start the reconstructive process, which I think is something that as a breast cancer patient, I'm very grateful for because I didn't have to look different in clothes. Shout out to my team at Johns Hopkins. Everyone has been amazing and they've really helped me get through this challenge. So I am very thankful for them. So to tell you a little bit about stage 0 breast cancer, it is a pre-invasive or non-invasive breast cancer. And what that means in the vast majority of stage 0 cases, including my own, is that abnormal cells or cancerous cells were found in the milk duct of the breast, but they were not actually found in the breast tissue. So if they're found in the breast tissue, that would be called invasive breast cancer, and that's anywhere from stage 1 to stage 4. Now, the interesting thing about stage 0 and why it's taken seriously is because some cases of stage 0 breast cancer could become invasive cancer, but doctors don't know which ones. Some of them could just hang out and not cause problems, but because, again, doctors don't completely know which cases will do what, that's why it's treated seriously. Now, one difference between treating invasive cancer and stage 0 is that chemotherapy is typically not on the table for stage 0, and not everybody who has invasive breast cancer has chemotherapy either. But one difference is that because stage 0 is localized, once you remove it, it can't regrow. Now, that doesn't mean something else couldn't grow, but at least that can't regrow. So you don't have to worry about a recurrence of the same cancer as you could have with invasive cancer. So I, through my diagnosis, learned there was a lot about breast cancer that I thought I was aware of, but was actually not. Not that I thought I was an expert, but I thought I knew a little more than I actually ended up knowing. And I want to talk about 2 myths or sort of half-truths about breast cancer that you may have heard or you may have thought and how they relate to my own personal story. Now, the first one is the fact that breast cancer, the majority of people who are diagnosed with it actually do not have a family history. The myth is that most people do. And we probably think that maybe because of what we see at doctor's visits, whenever there's questionnaires, we're always asked if we have a family history, and we probably know someone who has a family history, and maybe you do as well. But the reality is that only about 5 to 10% of cases involve family history. Now, I would guess that the reason there's a lot of focus on that is because that's a known risk, so that makes sense. If you know there's a risk, then you can actively address that risk versus other cases like maybe mine that may be unpredictable because I did not have a family history. But I also think that focus on family history, though, does obscure the fact that most women don't have that, and that was true in my case. The other thing is that the other myth, or maybe half thing we talk about, is this idea that breast density is no big deal. Not that breast cancer isn't a big deal. I think we all know that that is a problem. But the myth, the other one, is that breast density is no big deal. Now, breast density actually is being increasingly studied, and at least from what I have been told, and also from what I've read, that there are more and more studies that are showing that that breast density is a very significant risk factor for breast cancer. And I actually had extremely dense breasts. That's what I found out through this process. So that is something that I've come to be more aware of. Now, if you're a woman, especially if you've been around for at least a few decades, you've probably heard of breast density before, and maybe you know women who have dealt with dense breasts, but just so that we all have at least a basic idea of what it is. Your breast could either be made up of dense tissue, and there's a couple types of dense tissue, or fatty tissue. And some women have more dense tissue than they do fatty tissue. Some women have more fatty tissue than they do dense. Now, you are more likely to have more dense breasts if you are slimmer and if you are younger. So the reason if you're younger is that as you reach menopause and beyond that, your estrogen levels, other hormones change, so that changes your density level. They become less dense. And then also, when you're slimmer, that's because women who are slimmer, have more dense tissue than they do fatty tissue. So that's just kind of a basic of what it means to have like dense tissue. Now, about half of women who get mammograms, which is generally women 40 and older, actually have dense tissue. So it's not uncommon. So I think that that's one reason why we often think that it's no big deal, because a lot of women have it. But what I have seen from the research that I've looked at, and even what I've been told, is that the level of density matters. Now, most women who have dense breasts have what they call heterogeneously dense breasts. And what that means is that the majority of your breast tissue is dense. You still have some fatty tissue, but more dense tissue. So I haven't seen as many percentages on this category, but it is 40% of women who get mammograms, but it seems like it's about 50 to 74%, because there's two other categories below that are not considered dense, and those are women who have more fatty tissue than dense. But you're classified as dense if you have more dense tissue than fatty tissue. But the last category is 10% of women that I found out I fall under who get mammograms, and these are women with extremely dense breasts. And what that means is that you have a density level of 75% or greater. For extreme density, I have seen a percentage. Now, what the significance of that is that doctors are still trying to figure out why, but women who have dense breasts are more likely to be diagnosed with breast cancer. That's still ongoing in the research, as I just said. But what they have found, and in one of the largest studies on breast density that I will also link to, has shown that women who have the extreme dense category of 75% or more have a fourfold greater risk of breast cancer. And through my diagnosis, I found out that I had extremely dense breasts. And that was something that I saw from the beginning. My first mammography report. Now, my first mammogram was actually the one in which I got diagnosed with breast cancer. And so that was the first place I saw that. But then I also had to have additional imaging. And then eventually when the cancer was removed, the pathologist actually had estimated that my density level in the samples was 90%. Now those were just samples, but that's an indication of everything that I saw, that they are really dense. Now, there are, again, questions about what that means. Again, doctors are not sure why, but there also is another risk related to density, and that is it is harder to detect when there is breast cancer on a mammogram. Now, if you have more fatty breast, that shows up as dark on a mammogram, and tumors show up as white. So that makes them easier to see. But extremely dense or dense breast show up as white on a mammogram. Now, if you're extremely dense, it's going to show up as even more white than someone who's heterogeneously dense. And so what ends up happening then is that it's harder to detect when there is actually breast cancer. And in my particular case, like I said, I had my first mammogram when I got diagnosed with breast cancer. And I had also not had any other mammograms because I had just turned 40. This was at the end of last year, and I was still going to get a mammogram that year. But this ended up being the first one that I got. And so, one, I did not have a baseline, but also because my breasts were so extremely dense, I had to keep going into the mammography room for like over an hour because the radiologist was being really meticulous. But it was explained to me that like when you have a lot of calcifications, and that really can be changes to the breast, but that also could mean tumors. So the radiologist had to sort out what was just a normal change to my breast and what was a tumor. So one description I got was that it was like looking at snow on snow. So that is also why when you have dense breasts or extremely dense breasts, that's why additional imaging is often necessary in order to ensure that the full scope of your breast is actually seen, and that nothing is missed. Because when you have dense breast, it is easier for cancer to be missed. And in my case, like I said, my tumor was pretty large, even though it was only just in the milk duct. It still kind of grew from that area. So even though it wasn't in the tissue, it had still kind of grown around the breast. And again, my whole breast needed to be removed. But on the mammogram, the extent of the tumor was not fully seen. It wasn't until I did an ultrasound that showed us a little more, and then an MRI that showed more. And without that additional imaging, I may not have known about my need to actually remove my whole breast, because what I'm thankful for is that all of the cancer was removed with that one surgery. So those are the two areas that I wanted to share with you about. And that brings me back to where I started. Why breast cancer research is so important, because there's so much more to learn about this disease. We owe it to our daughters, our mothers, our aunts, our cousins, our significant others, to help them to, as much as possible, even if it doesn't happen in our lifetime, in someone's lifetime, that we end breast cancer, and hopefully the sooner the better. So you can help me with my campaign by first donating. Now, if you're listening to this, you may not know me. I'm still going to ask you for money, but this is for a good cause. And if you're still listening, I appreciate that. If you don't know me, I would love it if you could donate at least $10 to my campaign. I have thousands of dollars to raise for the walk before September 10th. And if you do know me, I would love it if you could make at least a $25 donation. Now, whether you know me or not, I would love it if you gave me more money than that, but that is my initial ask. The next thing is I would love for you to personally share this with someone with a personal note, and ask them to also share it with somebody else. And then also to share even more publicly. So if you're looking at this, you're probably seeing it on social media. And if you know me, I actually don't post very much on social media, but because this is such an important cause, I am going to be blasting your feeds. I apologize in advance, but you can help me by reposting. So if you're going to be blasted, you can also like blast somebody else, just so that the word gets out more. I would really appreciate that. So thank you so much for your time, and to ending breast cancer, and to breast health.